The Congressional Budget Office has just released its report on the health care bill passed by the House earlier this month. Let's get to NBC's Kasie Hunt, who we just can't quit, on Capitol Hill.
Hi, Nicole. We do have breaking news here with this CBO report, as expected, late this afternoon. So the initial top line, we had been talking about whether or not the House may have made some errors in this bill and would need to have another dramatic floor vote. That is not the case based on this CBO score. This estimate says that it will save about $119 billion over the course of 10 years. They needed that number to be more than $2 billion, so they've cleared that threshold easily. This will allow them to send the bill to the Senate and proceed to the next steps. But there are still some numbers in here that are a little different from what we knew before this. The original version of this bill had been scored, and of course they voted on this new tweaked version without having this information. They say here that 23 million Americans would lose insurance under this bill compared to current law. Previously they had said 24 million people would lose insurance. One thing I do think is worth pointing out, they do make a distinction, the CBO, between people who would live in states where these essential health benefits and other key parts of Obamacare would remain in place, and states where they potentially would waive all of those requirements. You'll remember that was the major change that Republicans made to help get the Freedom Caucus, those conservative members, on board. They said, okay, states, you can opt out of these key things if you show that you can cover people in another way. The other thing that the CBO says here is that they're very doubtful that states can actually cover people in another way, that they believe, according to this report, that those with pre-existing conditions would be ultimately unable to purchase health insurance at premiums that are about what they face under current law. Essentially, that if you have a pre-existing condition and you live in a state that waives these requirements, it's likely that your premium would skyrocket. Now, the other piece of news that Republicans were looking for was an overall decrease in premiums, and the CBO does estimate that those premiums for people in states that don't waive these requirements and that continue under kind of the Obamacare-style system, that those premiums would decline by about 4% over the course of 10 years by 2026. But the challenge is that we would return a little bit, according to the CBO, to the way things were before. So if you're younger and healthier, you're paying much less. If you're older and you're sicker, you're paying a lot more. Those are some of the key tenets here in this law that would allow insurance companies to adjust premiums on a wider range than they can right now. So on the whole, again, this allows Republicans to move forward. This allows the Senate to start writing this bill. But at the end of the day, these metrics not necessarily dramatically different from the ones we saw before.